Hello, attention! This video is absolutely important nowadays, as venous thrombosis is silently increasing, affecting more and more people. Regrettably, many people only notice the signs when it's too late to reverse serious damage, or worse, when their lives are at risk and in danger. Thrombosis occurs when a clot forms in a blood vessel, obstructing or impeding blood circulation. Thrombosis can happen in different parts of the body, like the legs, lungs, brain, and even the heart, and can be caused by various factors and different circumstances. However, deep vein thrombosis is the most common type and takes place when a clot or thrombus forms in one or more deep veins of the body, being much more prevalent in the legs of individuals. Guys, if not treated quickly, thrombosis can lead to serious complications such as pulmonary embolism, stroke, heart attack, and even limb amputations. Now you will discover the crucial indications that can indicate the presence of blood clots. However, please remember that having one of these symptoms does not necessarily mean you have thrombosis. They are simply risk indicators. The utmost important thing is to remain alert. If you notice multiple symptoms, do not hesitate to consult a doctor for investigation. The initial indication is cramps and a sensation of tightness in the legs, which can even pulsate. These cramps and tightness that occur as a result of thrombosis typically also accompany a pain, that abrupt pain, with swelling and a weight or pressure sensation in the affected area. And typically this occurs in one leg at a time. The second sign is an increase in heart rate, which can be perceived as a rapid heartbeat or palpitations. This symptom occurs due to the difficulty of blood to circulate properly to the affected area, making the heart work more intensely to compensate. Gentlemen, the third sign is when you begin to encounter excessive sweating. In this case, it may be the result of the body trying to compensate for compromised blood circulation. The fourth sign is when you experience swelling in your legs or feet, knees, arms, or hands, which typically manifests on just one side of the body. In this case, do not waste time and seek medical help as soon as possible. The swelling resulting from a thrombosis occurs due to the obstruction of blood flow caused by the clot, making it difficult for proper drainage of fluids in the affected area. The fifth indication is when your skin begins to change color in the impacted region, becoming somewhat pale or reddish. This occurs in the thigh, arm, and calf. The sixth indication, individuals, is abrupt fluctuations in blood pressure that can decrease or increase. This alteration due to thrombosis can be a consequence of blood blockage by clots, and this hindrance typically causes blood pressure to elevate. The seventh sign is when you touch a specific area of your body and realize that it is hotter than normal, hotter than the rest of the body. And if this symptom is accompanied by pain in the area without you having sustained an injury, this may be an indication to sound the alarm. The eighth sign is when the veins become dilated or swollen due to the accumulation of blood and increased pressure in the area affected by the clot. These swollen veins can cause pain, discomfort, and a feeling of heaviness or pressure in the affected area. The ninth sign is shortness of breath, which can be caused by the presence of some blood clots in the lungs, leading to a condition called pulmonary embolism, which can even be fatal. Pulmonary embolism happens when a blood clot becomes dislodged and moves to the lungs, obstructing blood flow in that region. The 10th sign is an unexplained cough, which may or may not come along with a strange pain in the chest. In this case, the cough is typically dry and persistent, often with breathlessness, chest pain, and bloody phlegm. If this happens, run to the hospital because it's urgent. A big hug and a kiss on your heart.